All right, guys, welcome back to Underground Science. In this video, we'll be talking about toll-like receptor 4. All right, so we'll be talking about how toll-like receptor 4 gets stimulated uh, and what happens afterwards. Okay, and a few examples, right, of how toll-like receptor 4 does get stimulated, or the main way, right, is of course certain endotoxins like lipopolysaccharides. All right, that are on the surface of gram-negative bacteria. Okay, so that's important to know. So we have lipopolysaccharides that these gram-negative bacteria can actually release. Okay, and then that's what can lead to the activation of toll-like receptor 4. Okay, so some examples, right, would be Pseudomonas, right, or E. coli, or Neisseria meningitidis, right, that can cause meningitis. So basically what happens is, right, let's say any of these gram-negative bacteria release these lipopolysaccharides. And also, let's say that we're talking about E. coli, right, for example. So we know from our previous videos that uropathogenic E. coli can lead to UTIs, right? So, but what if E. coli, right, from the urinary tract enters the bloodstream and causes like urosepsis, for example, right? So let's see what happens then. So, so if we take this as an example, right, or any gram-negative bacteria, um, what's going to happen is first we should know that the toll-like receptor 4 again is on the surface of our cells. So for example, it can be on the surface of macrophages, right? This toll-like receptor 4, or even endothelial cells, dendritic cells, right? So let's say that we take this cell right here, and let's say this can be an endothelial cell or a macrophage, right? And we have toll-like receptor 4 on the surface right here. Okay, so if lipopolysaccharides are released right from these gram-negative bacteria, what happens is the first lipopolysaccharides actually bind lipopolysaccharide binding proteins. Okay, so first the lipopolysaccharides bind the lipopolysaccharide binding proteins that are in your bloodstream. So if we represent these lipopolysaccharides, right, which are released by your gram-negative bacteria, and then this in green will be our lipopolysaccharide binding protein, okay? And this will be our lipopolysaccharide. So first, the lipopolysaccharides bind the lipopolysaccharide binding proteins in the bloodstream. Then these lipopolysaccharide binding proteins, right, can actually come over to the CD14 molecule, right, on our, whatever cells that we're talking about here, in this case, macrophages or endothelial cells, or any of our cells that have toll-like receptor 4 on it, right? So the lipopolysaccharide binding proteins will take this lipopolysaccharide released by your gram-negative bacteria, and it will come over on any of these cells that have our toll-like receptor 4 molecules on it. But first, what's going to happen is it's actually going to be brought to a CD14 molecule, okay? A CD14 molecule. And actually, green's not a good choice because we did green representing lipopolysaccharide binding protein. So let's do blue, I guess, right? So this is going to be our CD14 molecule, all right? So once CD14, okay, which is also expressed on, um, our macrophages and endothelial cells, right? Once CD14 receives this lipopolysaccharide from the lipopolysaccharide binding proteins, it's going to actually give it over to the toll-like receptor 4, right? And actually, another part of toll-like receptor 4, if I just drew like a complex, right? So let's say this was toll-like receptor 4, all right? And then part of the toll-like receptor 4, I'll just draw another protein like that, right? And let's say this yellow protein is MD2. Okay, MD2 and toll-like receptor 4 actually form a complex. Toll-like receptor 4. Okay, MD2 and toll-like receptor 4 form a complex. What CD14 is going to do is it's going to receive the lipopolysaccharides from the lipopolysaccharide binding proteins. It's going to transfer it over, okay, to the MD2T and the toll-like receptor 4 complex. So now we have our lipopolysaccharide right here, right? And then, of course, the MD2 is important because it's actually going to stabilize the binding between the toll-like receptor 4 and the um, lipopolysaccharide. Okay, so once that happens, toll-like receptor 4 will be activated. And as we know, once that's activated, it leads to the activation of the MyD88 pathway. Okay, so toll-like receptor 4 is activated. This leads to the activation of the MyD88 pathway. This eventually leads to the activation of TRAF6 and then eventually the activation of nuclear factor kappa B, right? And we know nuclear factor kappa B goes to your nucleus, increases gene expression, and leads to the production of many, many cytokines like interleukin 1, interleukin 6, interleukin 8, interleukin 12, TNF alpha, right? And so on. But the thing about toll-like receptor 4 is it not only does it activate the MyD88 pathway, it also activates the TRIF pathway, as we've seen in toll-like receptor 3. Okay, so some of these toll-like receptor 4s, right, some of the toll-like receptor 4 molecules, it doesn't all have to activate the MyD88 pathway. It can also activate the TRIF pathway. So what happens there is, right, so let's say this is another um, macrophage or endothelial cell, right? A cell that has our toll-like receptor 4 on it. Let's say toll-like receptor 4 right here gets activated due to lipopolysaccharides. We saw it can activate the MyD88 pathway, but some of these toll-like receptor 4 molecules, right, receptors, can actually go from the cell surface and inside and get inside of an endosome, okay? So it can, instead of staying on the cell surface, it can move from the cell surface to endosomes, which are present inside of our cells, okay? So this is going to be our endosome, and inside the endosome will be the toll-like receptor 4. Once that happens, this can signal the TRIF pathway. Because remember, when we're talking about toll-like receptor 3, that we said that was inside your endosomes and that responded to double-stranded RNA, right? So once the toll-like receptor 4 is inside the endosomes, this can also stimulate the TRIF pathway, just like toll-like receptor 3 did, okay? So if this stimulates the TRIF pathway, what do we know about that? So we know that the TRIF pathway, if that gets stimulated, this will lead to the production of IRF3, right? And remember, what did IRF3 do? IRF3 led to the production of interferon beta. Remember, interferon beta, that induced an antiviral state by doing what? It increased the expression of MHC1 molecules and also recruited natural killer cells, right? Which are important for destroying cells that are infected with a virus. All right, so that's going to be the TRIF pathway. Now, the MyD88 pathway led to the production of all these cytokines. Now, why is that important? Right? So, for example, TNF alpha, it can recruit neutrophils. Okay, so let's write in a different color. It can definitely recruit neutrophils. Let's fix that. Recruit neutrophils. And it can induce a lot of vasodilation. Okay, a lot of vasodilation. And why is that? Why can that be dangerous, right? Because if you induce a lot of vasodilation, a lot of vascular leakage, that can reduce your blood pressure. Okay, so that can lead to a reduction in your blood pressure. So that can't be good, right? Because later, if that leads to if you have severe sepsis and severe inflammation and a severe reduction in blood pressure, that can lead to shock and ischemia of organs, right? Of course, we know interleukin 12, right, can eventually lead to the increase in production of interferon gamma through the Th1 subtype, right? And interferon gamma can attract and activate macrophages, right? can attract active macrophages, and macrophages can come in and contribute to the inflammation. Interleukin 8, we know that it's important for attracting neutrophils, which again can come to the site of inflammation and release reactive oxygen species and enzymes and further increase inflammation. And then we know interleukin 6 can go to your liver and increase production of acute phase reactant proteins, right? Acute phase reactant proteins. And then it can also, of course, all these cytokines can, lead to fever, right? So let's say interleukin 1 can go to your hypothalamus and induce fever. But all these cytokines in general can lead to, can contribute to the overall process of inflammation, fever, right? So if we have a lot of cytokines that can lead to uh, large amounts of vasodilation and that can reduce your blood pressure and may lead to shock, right? We also know if this gram-negative bacteria is in your bloodstream, and we said that toll-like receptor 4 is on your endothelial cells, right? So if we have a lot of activation of interferon beta, we have a lot of we have a lot of production, my apologies, of interferon beta, a lot of production of cytokines, and we said that toll-like receptor 4 is on your endothelial cells also, then this can eventually lead to endothelial damage, right? So this can lead to endothelial damage. And we know if this is happening, throughout your bloodstream, right, in various parts of your body, in various blood vessels located in your body, right, this can lead to widespread endothelial damage. And this isn't good because remember, if the endothelium is damaged, this can lead to clot formation, right? So you can get a lot of thrombi formation. And if we know that if you're consuming coagulation factors and platelets to form little thrombi throughout your body, right, that can consume coagulation factors, consume platelets, and actually put you at an increased risk of DIC, right, which is a condition where you're consuming all your coagulation factors, you're consuming all your platelets, so then you start to bleed. Okay, so it's actually not this is not a good thing. All right. So for example, if we took the Neisseria meningitidis, for example, right? And if all this inflammation and damage and destruction was happening in your meninges, which cover your brain tissue, right? Then of course you would have things like a headache, right? Headache. Of course, all this inflammation would lead to fever, and then you would have a stiff neck, right? All the common signs you see in meningitis, right? So that's another thing. Like this would be the signs that you would see in meningitis: headache, fever, stiff neck, photophobia, things like that. Of course, you may even see a rash, especially if it's Neisseria meningitidis, right? We know you'll see the petechial rash, but we'll talk about that in our micro playlist. But like, what if you took the just thing like um, thing that we can keep in our mind is if you try to analyze the CSF, remember this is a bacterial infection, right? So if you analyze the CSF, you would see, of course, you would see increased white blood cells, right? But then you would also see decreased glucose instead of like normally, like in most cases, if it's a viral infection in your brain, right? If you analyze the CSF, you would see normal glucose levels. But since this is bacterial, you can expect to see low glucose levels for the most part, right? So, but like this is getting a little off topic because this is going into specifically the Neisseria meningitidis bacteria and meningitis. But the whole point of the video was to show like the importance of toll-like receptor 4 and how it can respond to different gram-negative bacteria, right? How we know toll-like receptor 4 is on your white blood cells like your macrophages, dendritic cells, but also on your endothelial cells. So if your macrophages, if the toll-like receptor 4 on your macrophages are getting stimulated, for example, it can lead to a lot of production of cytokines, right? If your toll-like receptor 4 and your endothelial cells are getting stimulated, it can also lead to the production of cytokines, but also lead to the increased expression of the TRIF pathway, right? And lead to a lot of interferon beta production. Now, all these cytokines eventually will contribute to inflammation and destruction, right? If especially like if we're talking about your endothelial lining, that's bad because if you have destruction of your endothelial lining, that can lead to DIC, right? Because if you're forming clots, you're using up platelets and coag factors, which can lead to bleeding eventually. And also, if you have all this inflammation, you have a lot of widespread vasodilation, right, due to this sepsis, this gram-negative bacterium lipopolysaccharide release, and that can eventually lower your blood pressure and may lead to shock, which is obviously not good because then this can lead to ischemia and damage your vital organs. Okay, so that's the importance of total receptor 4. I just wanted to talk about that and the pathway of it, and talk about examples of gram-negative bacteria that can stimulate total receptor 4 and lead to the negative adverse outcomes. I hope this video wasn't too confusing. I hope you guys learned a little bit, and I hope to see you guys in my future videos. Thanks for watching.